Hi, I'm Dr. Herman, and welcome to this site about lupus. And you came to the site because you or somebody you love is suffering from very severe symptoms and has been diagnosed with lupus, or at least you think it may be lupus, and they have symptoms that appear to be like that of lupus, and we're going to discuss a little bit more about that in a moment. Also, if you notice at this screen that you're looking at on this page for this website, browardlupus.com, you notice there's another video just below this one. And in that video, I go much deeper into the understanding of the immune system. That video is about 22 minutes long. So once you're through with this video, and I describe exactly about what is causing lupus, you're going to get a much better detailed explanation of how your immune system or your loved one's immune system is reacting and causing this problem, this disease in the body. Most often patients who come into my practice who suffer from an autoimmune disease like lupus or multiple sclerosis or Hashimoto's thyroid disease or celiac disease, they've tried many different medications. They've gone to different doctors. They've had blood tests run maybe once, twice, multiple times, and the doctors tried different types of medications. You or a loved one may have already tried things like prednisone with little to no results. Maybe you got better for a little bit, or you thought that you did, and then it was a relapsing episode of problems, symptoms from lupus. Maybe you've tried anti-inflammatories because your joints hurt and the rheumatoid arthritis doctor said, the rheumatologist said, let's try an anti-inflammatory. Or maybe you're trying aspirin because that helps to keep the blood thinner, or you're trying maybe a neurologist you went to for different pains that you have in your body, and you're trying different medicines like gabapentin or Neurontin or Lyrica. It's because you've got to understand something. When it comes to an autoimmune disease, your body's own immune system is attacking your tissues. It's turned on itself. And in some patients, it may be all over body pain at times, and then the pain goes away. In other patients, or in those patients as well, it may be joint pain. Get really stiff, and I feel like my joints just hurt all the time. Sometimes more at night, sometimes more in the day. It all depends on the individual. Others have rashes that appear on their face. Some have rashes that raise, they become like bumpy rashes that appear on the body. And some others may have symptoms that are dealing with like constipation or insomnia, or some women may have hot flashes. Some people may have neuropathies that develop in their hands and feet. That's a possibility as well. Not all of these symptoms are 100% of the time. And what you probably understand by now, and what your doctors may have told you, is there are a multitude of symptoms that can appear, and they may diagnose you as a lupus patient once they've already seen the ANA antibodies are positive. I'll tell you a little bit about myself before I go further into the understanding of what we do in this office that's totally different and unique from what the doctors are offering you out there. I went to school first to become a chiropractor, and after chiropractic school I realized that chiropractic itself was not going to help people with all these different chronic inflammatory conditions like lupus, for instance. And I decided to go back to school to obtain a degree in functional neurology, where we know how to evaluate the brain in a totally different way than a regular medical neurologist does. I've also gotten certified in functional blood chemistry analysis, functional endocrinology, functional immunology, gastrointestinal disorders, mastering the thyroid gland. I've gotten certified in brain and brain neurotransmitters, or the brain chemistries. I am also obtaining a degree in neurochemistry and nutrition. I've gotten certificates in developmental disorders of the brain. So there is a totally different, well-rounded way that we can evaluate you. Now, first thing is, if we see that you have the ANA antibodies and you're already diagnosed with lupus, one thing that I'm going to do differently than what most doctors are doing is I take a step back and I'm going to look at you as a whole person. We know you have these antibodies attacking your system, and we know that you get flare-ups from time to time. Maybe it's constant for a few weeks, or maybe it stops for a little bit. But let's understand something. We've got to look at your systems. What I've been trained in functional immunology, first of all, as you'll see in the other video that's on this screen that you can click on and watch, is that your immune cells have gotten out of order and they're attacking your system. Your immune cells can get out of order and attack your system and create these antibodies because of different environmental stimuli, environmental stresses, in other words. It may be because of foods that you're sensitive to. It may be because you have infections in your intestines, like worms and parasites, or yeast or fungal infections. It may be because you have serious hormonal imbalances, and hormone therapy has not helped you. You may have sugar imbalances and anemias. You may be pre-diabetic or hypoglycemic, or even diabetic, and have different types of anemias, iron or B12 or some anemias. You may actually have an adrenal gland that is just not able to carry out all handle the stressful situations in your life. So what I do that's much more comprehensive to help you is, first of all, we've got to look. Let me tell you about the test that we run. We've got to be able to look at a very comprehensive blood analysis. And in that blood analysis, we're going to look at all the various systems of your body. And we're also going to look for some other antibodies. Because one thing you have to know, you must know if you're diagnosed with this disease, is that your own immune system doesn't only create these lupus antibodies, but it may be attacking your thyroid. It may be attacking your intestines. It may even attack your brain. It may attack your skin, your bone, your reproductive systems. You've got to understand that as well. So we can look for other antibodies to have a much better understanding of what's going on. I've been trained with one of the world's leading PhDs in immunology. He's written over 300 papers. And what he has also helped me understand, and that I do with all of my patients with these chronic ailments, is we can actually look at in one of your white blood cells on a test, not just a regular white blood cell test, but we've got to look even further and deeper. And when we look at these T and B lymphocyte panels, we can find out by using a functional a range of what normal and abnormal is, that if you fall above a normal range, and it's very hyperactive immune system, that means that you have an active antigen response. Your body is actively fighting something that's invading its system. And again, what invaders there are, as you look at the other video that's on the screen, you'll have a very clear understanding of what I mean by this. So we've got to look to see if you have an active antigen response, if your body's fighting something that's invading it. And then in other cases, I'll notice that when I look at that T and B lymphocyte panel, if it falls below the normal range, that means that your immune system for some reason has gotten so out of balance and it can't get back in balance. It's trying to do things, but since it's so out of order, it's dysregulated. It doesn't know what to do for your body anymore, and it's like in chaos. Literally, it's in chaos, and that's why it's ravaging your systems and creating these different problems that you can overcome. You can overcome. Next, what we've got to understand is we've got to study within your intestinal system. After we look at some of those blood cells, we're going to look in your intestines. And specific labs that I use across the country that test with DNA in your stool, your fecal matter, we can find if you have these different types of parasites that can cause immune chemical or inflammatory chemical reactions in your system. We're going to find if you have yeast and fungal infections in your intestines that can cause inflammatory immune chemicals to ravage your system. We're going to find if you have worms, parasites, if you have also something called a leaky gut membrane. If you have this leaky gut, the leaky gut can be caused by foods or reactions to foods, by different enzyme reactions against the intestines, by different invaders like parasites, worms, yeast, and fungal infections, by medications. Some people with lupus, it was a drug-induced autoimmune disease. We've got to look for if you have different brain chemistry imbalances that are causing the gut not to work properly. Remember, the neck bone's connected to the backbone. You've heard that before, but the body is the sum of all of its parts, not just one part, okay? We've got to look in those intestines to find out if you're having reactions to certain foods. And there are, as of 2011, there are some incredibly state-of-the-art, the most expansive stool and blood analyses that we can study that will show exactly which foods are causing the problem. It's different than what was in the past. It's not just one immune cell they're looking at. We're able to tell with a multitude of different immune cells that have been recently discovered. So some patients say, well, I already had that scratch allergy test, or I already had a food sensitivity study, Dr. Herman, and I don't have problems that you are mentioning. Well, that's not true. Let me tell you this. The scratch test is not useful, first of all. And second, blood tests or stool tests by certain labs, if they're run, they don't, sometimes these labs are not the best at what they report that they can do. Let me just explain that. And you've been to certain different restaurants that are better than others, or you've had people who work in your house that are better than others, and so on down the line, or better school teachers than others, right? Well, if that's a possibility, you've got to be open to understanding that there's a possibility that labs are better than other labs that report to do the same thing. Now, further, we've got to look at in your bloodstream and see if you have these inflammatory cytokines. That's a big word. The word cytokine means inflammatory chemicals and proteins that have gotten so out of balance and so activated that they are eating away at your cells in your body, and they're causing destruction of your systems. So one part of this immune system, on one side of the seesaw, if I can use this picture with you, is called the T helper 1 or Th1 side of the immune system. Another side of this system is called the Th2 side. So we have to have an equal balance. Both sides of that seesaw have to weigh about 100 pounds to be normal. But what happens from different invasions and stresses in the body is that the one side of this immune system may become 400 pounds and the other guy on the other side is only 100 pounds. How is it going to stay in balance? It can't. We've got to be able to figure out what made that happen, and we've got to be able to maybe add some, reduce the stress on this side and add some weight back onto the other side of the immune system and have a normal, equal balance. And there is a way to do that. So we're looking at specific cytokine cells on specialized blood tests. And we're able to tell if you have one side dominant immune system or if you have the other side dominant immune system. I can go a lot deeper in that on the other video that you'll watch if you click on that one on the screen. Further, we've got to run expanded male or female hormone panels. If you're a female who's still menstruating, you've got to understand that you have a whole month of a cycle. It's not just one speck in time on one day getting a drop of blood. You have a cycle. Hormones fluctuate through that cycle. If your hormones are not in the normal order, your hormones can be causing the stress, the imbalance of your hormones can be causing this whole nervous system, endocrine, immune system stress, joint stress, tissue damage in your body. We've got to look at the whole picture, not just estrogen or estrogen and testosterone. And there's a number of reasons that we know in functional medicine that can cause these hormones to get out of order. And we've got to look at the reason why for those. You've got to, every time you look at a doctor in the face and you're trying to get help from him or her, you've got to ask why. And keep asking why, so you can get to the bottom of it and you can get help. We've got to look a little bit further in your system, okay? We've got to be able to evaluate your nervous system in a different way. And what I do in this office when you come in for your consultation is I will go through a good 30-40 minute initial neurological evaluation. And with that neurological evaluation, we're going to find if you have these different imbalances in your nervous system. And the nervous system can become imbalanced. And when it's not doing its job, the right brain is not telling the left body 100%, and the left brain may not be telling the right body 100% what to do, your body will not function normally. Your digestion won't work normally. You may be getting other symptoms because of that, okay? We're going to go a little bit further besides that neurological evaluation. We're going to look for other chemicals in your body that can be causing problems. There's something called nitric oxide. When the bad nitric oxide gets too elevated in your system, it is known to destroy bone, destroy muscle, destroy nervous system, destroy cardiovascular structures. We've got to figure that out and elevate the good guy in the nitric oxide system and decrease the bad guy. And there are ways to do that. I can go a lot deeper when I meet with you. We've got to also look for these specific acids in your system that can destroy brain cells and destroy body cells. And one acid in particular is called arachidonic acid. And that's a big word. I can elaborate more. But this acid actually is known in neurochemistry textbooks that when it gets into the cell, it destroys the cell structure. It unravels the cell. If your cells are deteriorating because you have too much of this specific type of acid that's eating away at them, how are you ever going to be okay if that's not figured out and if that's not stopped and you don't get the good stuff in the system? Again, you've probably already tried medications. You've tried many different medications. You've gone to several different doctors and you're still suffering. Do you really think that those medications are going to help you eventually? Are you going to get the lucky number of milligrams you have to use of that pill or hormone? Do you really think that there's going to be some magical medication that's coming out one day? Come on. How long are you willing to let these companies and these doctors who don't know why you're having this autoimmune disease, how long are you going to let them play Russian roulette with your life? How long are you going to let them do that? How long are you going to keep trying different medications and never getting to the answer? I can help you. I understand the immune system. When you watch that other video that takes 22 minutes, it's just 22 minutes, you're going to understand much deeper about your immune system. You're going to realize there is hope for yourself and there is a way out of this. Again, I invite you to come into my office. I'd love to meet with you. There is a lot of paperwork you'd have to fill out so we can understand your systems a lot better. I do want to see different research that you've had done on yourself, different tests, MRIs, nerve tests, blood tests, and so on, whatever it is that they've done. And we're going to discuss your problem. And you're going to understand what needs to be done. And you can overcome this. There is a way to reduce the stress in your system, and you can stop these symptoms or eliminate most of them and live a better life and get off of or decrease to a great degree a lot of the medications you're on. My name is Dr. Herman. My phone number is 954-370-3100. Please make sure you and your family watch that other video that's on the screen and then call and I'd love to meet with you. Hope to see you soon.